Hello, everyone. Thank you for joining us today for this webinar. My name is Jordan Perlman. I'm the Program Manager of the Transplant Center at CHOP. I want to thank everybody for coming again to our first installment of the Transition webinar series. This event was originally planned to be an in-person event sometime last year, but was delayed due to COVID. Our transplant providers and nurse coordinators have worked very hard to put this event together for you in a virtual format instead, as we all understand the importance of transition readiness for our transplant patients and families, and we wanted to make sure that we were able to share this information with you. Transitioning to adult care with new providers, especially after being cared for by our wonderful providers here at CHOP, can be difficult for any patient. It's important to start this conversation as early as possible to ensure success. We are so happy that you decided to join us today and hope that you join us for the subsequent webinars in our series as well. And on our next slide, we have the future session dates and topics. We will be sending reminder emails to register for these sessions as they get closer as well. We'll leave this up, just a few more reminders before we get started. We're going to have time at the end of the presentation for questions. Q&A is going to be facilitated by John Savant, Physician's Assistant for the Kidney Transplant Team. We will answer some questions that were already submitted ahead of time when some people registered. But if you have additional questions, please use the Q&A feature that you see in the sidebar, and we'll address those questions either in real time or during the Q&A session at the end of the presentation. This session is going to be recorded to share with other patients, families, and providers after the fact, but your name and any questions that are submitted will not be visible in this recording. Because this is a Blue Jeans event and not a meeting, attendees' mics and video are muted. There will be opportunity for patients, parents, and providers to interact in the last webinar of our series in July. So sign up for that if that's something that you're interested in participating in, if you'd like to attend an interactive session. And if we can move to the next slide. Today, we welcome Dr. Jennifer Vittorio. She is the Associate Professor of Pediatrics in the Division of GI, Hepatology, and Nutrition at Columbia University Irving Medical Center, or CUIMC, and an attending pediatrician at New York Presbyterian Morgan Stanley Children's Hospital. She's the founder and director of the Platinum, or Pediatric Liver to Adult Transition Program at CUIMC, which focuses on the enhancement of self-management behaviors and transition readiness in pediatric liver transplant recipients. Jennifer is also the leader of the American Society of Transplantation Transition Working Group, which is dedicated to improving the health care transition process for all pediatric solid organ transplant recipients. We're very excited to have Dr. Vittorio here with us today to share her expertise with all of us. Dr. Vittorio, thank you again for being here. I am going to stop sharing now, and we'll pass the presentation along to you.
All right, thank you so much, Jordan, for that great introduction. Can you all see my slides okay? All right, so again, my name is Jen Vittorio. I am one of the transplant hepatologists up at Columbia, as was previously mentioned. Just a little bit about my background. So my early training, I actually was a med-peds resident, so I spent a little bit of time working with adults, and ultimately decided to focus a lot of my training and working with pediatric patients. Was definitely drawn to transplantation, and one of my real passions is working with some of our older patients, young adolescents, young adults, and helping them with this transition from a pediatric model of care to adult. So what I'm going to speak to you all about today is the importance of transition readiness following solid organ transplantation. Just a quick outline of some of the things that I'm going to cover today. So I want to start, kind of by defining this term transition that everyone keeps bringing up, and maybe mention how that's different from transfer of care.
Excuse me, Dr. Vittorio?
Yeah.
Hi there, sorry to interrupt. This is John. If you could share we can't see your slides. The share screen function on the right of the screen.
Let's see.
Perfect. Thank you.
Okay, yeah, sorry about that all. So like I said, I want to talk a little bit about the idea of what is healthcare transition. I'm going to go through some of the early studies that, have reviewed some of the outcomes in patients that were transplanted in pediatrics and were later transferred to an adult program. I'll mention a few of the barriers that people have talked about in terms of successful healthcare transition. I'm going to go through some of the transition readiness tools that are available out there and how I use them in my own practice. And then finally, at the latter part of the talk tonight, I want to talk a little bit about something called the 6 core elements of transition, which we've definitely incorporated into our transition model up here in Columbia, and I think, can really be helpful in a lot of different ways. So like I mentioned, to start off, let's talk a little bit about healthcare transition, right? So I think people like to use the terms transition and transfer of care interchangeably, but I want to make a little bit of a distinguish here. So healthcare transition is a process, right? It's changing from the idea of a pediatric model or approach to care to this adult model of healthcare, right? It's something that takes place over time. So it begins in early adolescence and it continues throughout young adulthood. This is different from transfer. So transfer is like an event. And this may or may not mean, finding a new provider or new team, but it's typically a change in location where care is provided. So if this means going from the pediatric hospital to the adult hospital, that's one of the ways that we talk about transfer. Another term you're going to hear me bring up is something called self-management, right? So this really means taking responsibility for one's own behaviors and well-being. So it might mean, being able to take your medications every day on time, recognizing when you're due for prescription refills, and knowing how to go about making those things happen. And then finally, the last term that I think it's just kind of important to go through is something called adherence, or a lot of people may refer to this as compliance. But this is really the extent to which, your behaviors are matching up with the recommendations of your healthcare team, right? So if your team is telling you to take your tacrolimus every morning at 9 a.m., is that something that you're doing? Are you forgetting more days than not? And how can we work to improve some of those things? All right, so simply put, let's talk about why are we here today, right? So just a little bit of background to let you know and to put in perspective, there are about 1,500 to 1,800 young people in the United States between the ages of 16 and 22 who have undergone a solid organ transplantation, much like yourselves, right? A lot of these people, it's important to recognize though, have some of the highest rates of rejection, death-centered graft loss, and chronic rejection, which can ultimately lead to organ loss. And we also know that in this particular age group, we have seen an increased risk for certain complications following transfer from pediatric to adult-centered services. I think transplantation is an incredible field, and especially over the last few decades, we've seen many advances in both medical and surgical techniques, which had led to a lot of young people like yourselves, surviving into young adulthood. So I think it's a great thing that we're here talking about this. What I'm trying to depict here is just showing you across the different types of organ transplants, how do young people fare? And so I think overall, we're doing really well. Outcomes are great. There's a reason why we're all working in transplantation. But I do want to make note that, in these age groups, right? So some of the blue bar being 11 to 17-year-olds, and the red bar being some of our older, adolescent patients, we do find that some of the outcomes over a 5-year time period or so may not be as high as some of our younger patients. So why is this be? So again, we're seeing an increase in survival rates for all patients with transplant. So now we're trying to shift from some of the short-term management to some of the long-term outcomes. There are a lot of guidelines out there from the transplant world that recommend starting transition preparation and planning in early adolescence, right? And the idea behind this is that continuity of care for young people is associated with improved outcomes and lower healthcare costs. So if we don't have an effective transition plan or program, this can lead to breakups in some of the healthcare and adverse reactions or poor outcomes going forward. This is a slide that I really like because I think it, at least for me, it provides a nice visual representation of what we mean when we talk about healthcare transition. So again, this is a process, right? It's something that begins in early adolescence and continues throughout young adulthood. So what I'm going to show you guys here, right? So this is the process, but each of these larger circles kind of represent different phases of adolescence. So on the left of the screen here, we see early adolescence, around the age of 12 or so. And within these larger circles, you see two smaller circles, right? And these represent the roles of parents or caretakers, and then the patient or the adolescent themselves. So early on, it kind of makes sense that we see a larger circle representing the role of parents, right? They're really the managers of your healthcare. They're the ones that are, looking at medications, making sure you're showing up to doctor's appointments, and talking with a lot of the healthcare team, right? So early on, really what we're expecting of a lot of our patients is just that they start to begin to participate, knowing the names of their underlying condition and things like that. But as we move through this process, what we're hoping to see is that these circles start to get a little bit more even. So in other words, we want our young patients to start to become more of the manager role. So they're going to take a lot more ownership and responsibility for what's going on with their bodies, their healthcare. And parents sort of shift to this role of more of like a supervisor, right? So for instance, it might be, a matter of, mom or dad may have filled your pill box in the past. And then eventually what we encourage you to do is kind of work with them to perform some of those tasks to the point where you sort of feel comfortable doing it. And rather than them having to place the pills, they're really just supervising and looking over and making sure that you're getting the job done, right? But then as we advance a little bit further to the right of our screen, during late transition, when we're starting to talk about finding adult healthcare providers and when that might happen, we really want our patients to be able to take ownership of their health, right? So they really become the manager, and parents are really at this point just consultants. So if there's something going on, you want to speak to them about their opinions, along with your healthcare provider team, they're there for an extra layer of support, but they're not the ones that are taking primary ownership anymore, right? And again, I can't emphasize this enough, but transfer or finding yourself an adult care team does not mean that this transition process ends, right? And there's a lot of reasons for that I'm going to go through today. But it's important that you know that it may not be your pediatric team that you're used to, but your adult team is there to also support you through the continuation of this process, all right? So what are the current outcomes following transfer of care right now? I'm not trying to bore you with the science of this all, but I do want to show you some of the early studies that really led a lot of us to begin focusing in this area. So here, I want to show a study that was done in a few pediatric kidney transplant patients, right? So these were individuals that were transplanted in pediatrics before the age of 18, and then were transferred to an adult care team. I'm going to show you, this graph over here to your right. So if you can see my red arrow, it's highlighting this thing called T. T represents the time of transfer of care. The other lines on this graph really represent your creatinine levels. And so what I want to point out is that before this T, these lines were pretty stable, right? So the creatinine levels were looking pretty good. Somewhere after the T, we start to see a rise in these numbers. And so what the care team noticed for this particular population was that, following the transfer of care, about 40% of their patients experience a loss of their kidney, their transplanted kidney, within about 36 months after transplant. And what's even more surprising is that in about 35% of the cases, they really didn't expect this to happen. So these were not, individuals that had been non-compliant or non-adherent while they were in pediatrics, but something, sort of happened that led to these change in outcomes. Another study, again, looking at transplant patients, kind of said, well, maybe there's something else going on during the time period. So what they did was they looked at a group of patients that were followed only in pediatrics, another group of patients that were followed only in adult medicine, and then compared them to what they call these transitional recipients. So transitional recipients, which is this bar here in the middle, this sort of lightish gray, were patients that received an organ transplant before they turned 18, and at some point during the study reached the age of 18 or older. And again, what they found was that there was something about this particular group that they were more likely to experience a loss of their transplant and then end up back on dialysis. So you can see after 1 year, 3 year, 5 years after the study, the bar in the middle is far higher than the other groups looking at only pediatric patients or only adult patients. So there seems to be something happening around late adolescence or young adulthood that maybe is contributing to some of these outcomes. So for me, like I mentioned, I have a real interest and really passion just for working with young people. I really find it to be so satisfying. You're a great group. And so when I started as an attending up at Columbia, one of the things that I was curious about was what were our current outcomes, right? What was going on with our patients that were transplanted in pediatrics and then transferred to our adult team here at Columbia, right? So I looked specifically at the patients that stayed with us because I had access to a lot of their records. And what I found was a couple of things that kind of disturbed me. So one was a lot of our health outcomes were just not as good following this transfer period. So what does that mean? So a lot of our liver transplant patients had abnormal lab values. They had more episodes of cellular rejection, which had sometimes evolved into chronic rejection or the development of something called cirrhosis. And many people were often requiring a repeat transplant. They had a decrease in their adherence. So what does this mean? It seems that many of them were not taking their medications, as we had previously wanted them to. And we noticed that there was a lot of variation in some of the levels of their tacrolimus. They were less likely to show up for office visit appointments. And then maybe contributing to that, we saw that there was an increase in what I call healthcare utilization. So a lot of people were showing up to the emergency department rather than the office. They were getting hospitalized more frequently, and there were a much higher healthcare costs. So while none of this is really good, the one thing that really stuck out to me that it kind of upset me was that we also had a high rate of mortality or death following this transfer period. So you can see of our patients that transferred from our pediatric program to our adult program, one of the things we found was that in 28%, so that means almost 1 out of every 3 patients that transferred, right, passed away sometime after this transfer. And when we looked a little bit further, to see if there were certain factors that maybe increased the risk for some of these outcomes, what we found is that a lot of our patients who had passed away also suffered from what I call a comorbid psychiatric illness. So these are things like depression, anxiety, eating disorders, PTSD, right? That was much higher in the group, much higher than the group that had survived. And we also found that there seemed to be a higher incidence of substance use as well. So while this was certainly shocking and unsettling for me, this isn't so different from a lot of the studies that have looked at outcomes in transfer. So how can we improve? So the Pediatric Committee of the American Society of Transplantation put forth a statement that said, prior to transferring to an adult-centered model of care, pediatric transplant recipients should demonstrate the ability to effectively manage their health. Well, what does this mean, right? So it means that they should be able to describe the reason for their transplant, know all of their medications, recognize their insurance provider, and how to contact their transplant team, among other tasks. Well, that's all great. We also know that what's true is that, when this doesn't work out very smoothly, when there's a poor transition process, there is an increased risk for organ failure. And this can result in higher healthcare costs, poor quality of life. Patients experience, physical symptoms. They're less likely to enjoy, a lot of their daily tasks. They're unable to, oftentimes attend school, graduate from high school, maintain employment further on. And like I said, the scary thing is that several patients also develop reasons where they might need another transplantation. I'm not sure if many of you are familiar with the term UNOS, or the United Network of Organ Sharing, but they too started to notice a trend in some of our young adult patients across all different types of organ transplants. And one of the things that, UNOS is responsible for tracking is where are patients now? And so oftentimes what will happen if, at different centers, if we're not able to get in touch with our patients or find them after a period of time, what ends up happening is that they get labeled as what we call lost to follow-up, right? So this graph here is looking at liver transplant patients across different ages. So the green bar at the top is patients who were transplanted between the ages of 12 and 17. And when they looked 10 years later to see where these patients were, it seemed that this age group, right, so this is going to bring them around the time of like adolescence, young adulthood, were more likely to have this loss to follow-up designation than a lot of the other age groups. So we saw this with our liver transplant patients. We saw this with many of our heart transplant patients, right? So that green line is still the highest. And certainly saw this with our kidney transplant patients, right, who also had some of the highest loss to follow-up designations. So what's going on here? What's getting in the way of making this smooth transition? What are the barriers, right? So I think the barriers are probably multifaceted. There's a lot that goes into this. There's a lot of talk, you hear people, just want to blame it on the patient. And, while there may be a component of that is true, that is certainly not the whole story. But I will say that, adolescence, we do know, is a tough period of time. I think sometimes, young people may not be adequately prepared to make that transfer from the pediatric world to the adult world. It may have something to do with not wanting to take their medications or not knowing how to do that. We know that this is an age where substance abuse, certainly rises. Many times we're dealing with, mood disorders, concerns for anxiety, depression. It's a really challenging time. I think pediatric providers are not without blame, right? I know that you all may experience some anxiety about leaving your pediatric team. I have to say the feeling is sort of mutual, right? Many times we've known you since you were little infants. We've seen you grow up. We become very attached as well. We consider you all to be like family for us, right? And so there, is a little bit of element where, I don't want to let go of a lot of my patients. I feel like I'm the one that can take care of them best, and I don't want to relinquish care. But that, can certainly, a lot of our feelings can be imparted onto you, and that might make you a little less excited or a little less likely to bond with members of the adult team. We may not be doing our part to assess whether or not you're ready for this transition, and we may fail to screen for things like mental illness, which are, factors that can certainly be intervened on and helped and treated. I think adult providers, it's not that they don't want to take care of pediatric patients, right? But sometimes they may not be as familiar with some of the childhood onset conditions. Certainly, for example, like biliary atresia is not necessarily something that they would be familiar with recognizing and diagnosing, but they are very familiar with caring for patients who have undergone a liver transplant. A lot of times the adult centers, they have, a lot more patients. Their time slots may be a little bit shorter. The practice may be a little bit busier. So it might not feel like there's that like intimate, assessment that you might have gotten from your pediatric team. And then finally, the healthcare system, right? So, there's always improvements that can be made there. And there's not a lot of funding dedicated to health insurance or healthcare transition programs. Different providers, are not really reimbursed for the extra time that they spend, going through and making sure that you understand what's being said and figuring out why maybe you're not showing up for your office visits. It's just not reimbursable. And also many times when we discover, different mental health concerns, we often struggle with, the follow-up and what sort of access do we have to different psychologists or psychiatrists within the community that may be familiar with someone who's undergone a transplant. This slide I put up here, not for just the patients, but for the parents and caretakers as well. So this was a study that was performed out of the NIH, a while back. And what they did was they looked at maturational changes in the brain, over time. And so what they found was, and I think is very interesting, is that executive brain functions, so those things that are responsible for making, a lot of your decisions, not based on emotion, but based on reason, were some of the last regions of the brain to develop, right? So that means that sometimes, our young patients may not understand the consequences of their actions, right? As mature as they may be, as smart as they may be, it's just not happened yet. And oftentimes this will not take place until their mid to late 20s. We also know that in adolescence, there is a higher rate of death. And so the mortality rate amongst 18 and 24-year-olds is almost doubled compared to younger adolescents. As I mentioned, we see an increase in substance use and abuse, and suicide rates are also triple that compared to younger adolescents. So this is all aside from the burden of having a serious health condition like transplant, where you're expected to continue to take medications and show up for appointments and, think about other things that pertain to your health. So when put all together, this can be a bit overwhelming. Post-traumatic stress disorder, or PTSD, is also very prevalent in the pediatric solid organ transplant patients. We know that traumatic medical events are often associated with lower quality of life, difficulties with adherence, poor outcomes. But again, I think these are things that I call modifiable risk factors, or things that we can intervene or seek to improve to help keep you healthy in the long run. Medical adherence, so we talked about that word adherence, right? And with very few exceptions, most transplant patients are going to need to adhere to lifelong medications, right? So this has to be an essential component of transition planning. And when you don't take your medications, we know that you get into trouble, right? So there is an increased risk of rejection, organ failure, right? And one of the things that's really interesting is that there have been several studies, particularly from the group out of Michigan, where, what they found was that older patients were more likely to report that they took ownership over their own health care and were able to administer their medications correctly. But what we found in practice was that actually the older the patient was, there seemed to be a higher risk for non-adherence. And I think there are a few things that go into this. When I've sat and actually talked with some of my patients, sometimes one of the things that I think I fail to recognize is that, they equate with taking medications as being sick, right? So they go to school, none of their friends are having to take medicines. And so by having those pill bottles, right, they feel different. And by not taking those medications, it's almost like they're, saying to themselves, I'm not sick, I don't need this. Other things that can happen is a lot of medications can have, certain cosmetic side effects. I know everyone here has probably been on prednisone or steroids at one point in time. Prednisone can lead to things like increased appetite, weight gain, acne, right? And so it can be really difficult to balance a lot of those side effects with wanting to really keep yourself healthy and protect your organ. Another study, out of the group in Mount Sinai here in New York also looked to see, is it really related to age? And so what they did was they looked at a group, again, followed by pediatric providers, and then another group followed by adult providers, and then a group that moved from the pediatric team to the adult team. And what they found, right, was that in this group, there was a lot of variation in their tacrolimus levels. And again, that variation means, if your team tells you that they want you to have a level of 5, and one week your level is 0, the next week your level is 12, well, that's a lot of variation. So it would sort of suggest that you're maybe not taking the medications correctly, or there's something else going on, right? And so what they found in this transferred group was that these variations were much higher after the time of transplant, and it seemed like this was something that got worse over time. But also more importantly, they found that these numbers were also high prior to the time of transfer. So it's not just about switching your team, right? But it seems to be something that's happening around this time, around this transition period. All right, so we're talking a lot right now, but what's the deal? When should the transition process start? So this is maybe one of the, difficulties with doing a virtual conference, but I wanted to sort of ask you all a question, right? When do you think the transition process should start? And I put up a bunch of different answers here. So I'm going to pause just briefly just to let you think about, what your answer would be. And while it may seem shocking, there actually has been a lot of literature written about this. And what has been found was that transition is probably something that should start around the age of 12 or 14, right? And so this might be a little bit crazy to think about a 12-year-old, moving to the adult team, right? Why would we start talking about this? They haven't even hit high school yet. But I'm going to go through why this is sort of important. And in talking about that, we've got to think about, I've showed you a lot of kind of like doom and gloom type of literature, poor outcomes, people struggling. So what can we actually do to improve this? I mentioned at the beginning of the talk something called the 6 core elements of transition. There is a National Health Alliance, something called GOT Transition. If you haven't had the opportunity yet, I absolutely recommend going to their website. It's gottransition.org. I'll put up the website a little bit later on in my talk, but it's fabulous. It's not meant to just be for medical personnel, but it's also a great resource for parents, caretakers, patients themselves. It talks about a lot of the things that you can expect during this time period, how to adequately prepare yourself going forward. And also on there, they highlight these 6 core elements, right? So these 6 core elements are meant to kind of be like a sort of system, an outline for a process, a way to model this time period. They give you ideas of suggested ages, how to achieve a lot of these different goals, and when it's appropriate to move on to the next one. So I'm going to go through these a little bit more detail. The first core element is something called the transition policy. So I don't expect you to read this document to the right, but this is just an example of what we do here with some of our patients. Transition policies are often not just developed by the medical team, but usually with the assistance of patients and their caretakers as well, right? Because I think it's all important that everyone sort of have an opinion about how we can do this best. In our transition policy, we talk a little bit about what is transition of care, right? When it should begin, like I mentioned, our policy is we start talking about things or shifting our approach around the age of 12. I think it's also important to give an idea of, well, what time do we expect that we'll be asking you to find an adult provider, certainly with assistance from us. For us, it's by the age of 22. We choose 22 on purpose because a lot of people, may choose to go on to college, maybe after graduating high school. And so there's a lot of change. So we try and be a little bit respectful about not making too many changes at once. Particularly if, college or your job may lead you to move around a little bit and you might not be close to your pediatric center in the long run. We also talk a little bit about privacy and consent issues. So what happens when you turn 18, right? Because legally you are viewed as an adult. And rather than asking your parents or your caretakers for permission to perform, maybe blood work or certain procedures, we're going to be looking to you to start giving us your consent and your permission to do a lot of this. And that can be a little bit overwhelming as well. The next core element is something called transition tracking and monitoring. So it may sound sort of simple and obvious, but I think it's important, for each of the transplant teams to kind of create like a database, right? A way to keep track of, who is eligible for a lot of these transition assessments and tools, right? What we do is we try and incorporate it into the electronic medical record. I think that's one of the benefits from having an electronic medical record right now. And we tend to, again, target patients starting at around age 12. We want to make sure that they're at least 6 months, maybe a year or so from the time of transplant. And that's because, around the time of surgery, there's a lot going on, right? So it's maybe not the time to be focusing on issues like insurance and whatnot. We use this database to also keep track of patients' progress and to kind of highlight things that we need to improve upon. The third core element is something called transition readiness, right? So this is really trying to figure out, together, where are we, right? Where are our patients? Where are we with our, education? How do we recognize areas that we could, maybe focus on a little bit more, improve on a little bit more? To do that, there's some things out there called transition readiness assessment tools that I'm going to show you a few examples of that can kind of help guide us. For us, we started administering those in our practice again around the age of 12 or so, and it's something that we do annually so we can kind of keep track of progress. These also, once we identify areas that may need some work, it also helps us to kind of set some goals together. And we use these to work with our patients, with our parents, with the rest of our care team to kind of prioritize our actions. And, we make sure to document them specifically so we can follow up. This slide just shows you a list of some of the different transition readiness tools that are available out there. Some of you have heard some of these terms before, like the track or whatnot. I'm going to show you one of the tools that I like to use in my practice for a few reasons. So one of the things that I use is something that was developed by the group down at UNC called the transition scale. This is something that's typically administered by someone from the healthcare team. There is a survey that's available for patients. There's also a survey that's available for parents. It's available in a few different languages. It's been validated, or that means used in patients 12 and up. Typically, they say it takes about 8 minutes to administer. I will be quite honest that when I use this in my practice, I tend to use a lot of these questions as opportunities or ways to spark conversation. So for me, it can sometimes take a lot longer. And the other thing that I really like about this tool is it sort of breaks down the questions into 10 different areas that I think are important to focus on for successful transition. So this team is all about mnemonics. I don't know, they're really incredible with the creativity here, but so each of the letters in transition stands for a different topic that's important. So the first thing, is usually just asking people to kind of identify why they're there in the office that day. What's the name of their underlying condition? I will say I have been shocked, where I've sat with, I can think of one, adolescent AP student, right, who I'd been seeing for a number of years, who had undergone a liver transplant. And when I asked him this question, he couldn't tell me the answer. And when I sat and worked with him a little bit more, I said, you know what, just tell me what type of doctor I am. And all I was looking for was like liver doctor or something like that. And he also didn't know that. Right. So we had to, really kind of reset some of our goals and sort of start from the beginning, but that's okay. I was taking for granted that he kind of knew, who I was and why he was there. We certainly go through medications, the names of the medications, the doses, what they're for, what can happen if you don't take them. We talk a little bit about, again, this term adherence, right? So can you remember to take your medicines in the morning? What about at nighttime? Do people have to remind you? Are you using maybe certain apps or alarms to help assist with this? If not, I have a few recommendations. Are there certain diets that, we should be adhering to, certain foods to maybe avoid? We talk a little bit, again, based on age. I'm certainly not going to ask a 12-year-old whether or not they're going to the pharmacy to pick up their medications, right? But I think that's an appropriate thing to be talking about with an 18, 19-year-old, especially someone maybe who's just gotten their driver's license and looking for a reason to be driving around. We talk about things like reproduction, right? So it might seem, again, obvious or simple, but one of the questions I always ask my patients is, do you know if having had a transplant means that you can or you can get someone else pregnant? And I will say I have gotten some pretty shocking answers here also. If I can pause for a second, I have to be clear because I've heard this from more than one of my patients. Tacrolimus is not the same as birth control. I don't know who is spreading that rumor. I don't know what website or blog that may be on, but that is absolutely not true. And I have unfortunately had a few patients that learned the hard way that tacrolimus is not the same as birth control, and they can very easily get pregnant. So I just want to make that clear. We talk a little bit about future plans. Is it school? Is it going on for more education? Is it finding a job? What interests them? How that may impact on who, their health and maybe who their future transplant doctor may be. We talk about insurance. What is that? Why is it important to have? Can they tell me the name of their insurance provider? Do they know how long they're going to be covered, under the current plan? Who's going to be responsible for their healthcare going forward? Is it going to be mom and dad? Is it maybe going to be them? And when the time comes, how do they go about finding a new adult provider? Google is great, but if you have a pediatric team, you have a transition team, they can also be a great resource to, maybe point you in the right direction and find you a good fit. After we do a lot of the identification of transition readiness, we start talking about planning, right? That's the next core element. And, sort of together, we kind of come up with, maybe what are the things that we want to achieve together before, we send you over to an adult doctor. What are the goals we can all achieve? Let's start, in the office rather than talking to the parent, which I might do with a toddler more than appropriate. I really try and break that habit, and I really want to engage with my patients, right? And I think it also, kind of when someone's sort of staring at you and asking you the questions, it kind of forces you to put down that cell phone and pay attention and really participate in the conversation. And I think these are great habits to get into because these are expectations that a lot of adult doctors may have. We talk a little bit about timing. So what makes sense? Maybe I have, someone who's 19 who's planning on, moving either for school or for a job or for family to the West Coast. Certainly it doesn't make sense for me to continue to be their provider if I'm nowhere near them. And so we start talking about, well, let's find you a team. I always try and be very transparent, hey, so and so, you're 21 years old now. We're due for an office visit at the end of this month. I'd like you to check in with me. We'll make sure everything's going okay. And then my expectation is that we're going to set you up with an adult team within a few months after that visit. But this will probably be our last visit together. I don't start having those conversations at the age of 20 or 21. I have them much earlier. So none of this is really a surprise. And then, like I said, we have a whole multidisciplinary team that really works on achieving these things. I put this cartoon up here for a reason. This may or may not apply to anyone who's participating in this webinar tonight. But the other thing that I have found to be useful is to also engage, especially early on in some of our transition clinic visits, the parents or the caretakers, because I think, I've seen a couple of things happen. I've had a few parents sort of show up, they hear transition and they're like, oh, well, I don't need to be here anymore. But when your child is 14, that's just not true. And we have a lot of things that we need to go through together. Or, I've had, 21-year-olds where I can't even, get out the question. The parent is already, answering, for their child, right? Going through a lot of the questions that I was mentioning earlier, I've heard patients or I've had parents, sort of say, wow, I didn't know you knew that. Or I've heard the opposite, like, come on, you know this, the names of your medications. Yes, you do. So I think it can be a little bit eye-opening for everyone. And I think it's also, I'm seeing, patients sometimes a handful of times each year, but those snapshots are really not enough to make, meaningful differences. So we do rely a lot on, families to help support a lot of the things that we're talking about, a lot of the goals that we're setting during our clinics at home as well. This is another tool that I sometimes use. This again was developed by the group out of Michigan. It's called the Allocation of Responsibility Survey. And, while most of our things I would say are, probably on iPads and part of the medical record these days, this is something I actually like to keep on paper. And so it's called the Allocation of Responsibility Survey. There's, 14 different questions that talk about, different things that are often related to self-management, like who remembers your morning medications? How about evening medications? Who's calling for refills? Who remembers lab draws? And you can see a number of different columns here. So this column on the left is pretty much, implying that most of the time, this is the responsibility of the parent. The column over here, the threes are that the adolescent or the young adult is actually doing this. And the column in between, these twos, mean that it's usually a combination of both, right? And so, I usually start off these circles may be all over the page. They may be skewed to the left or to the right. But what I really like is that it basically provides me with a visual representation that I can share with my patients. And I tell them that my goal is to shift everything over to the right side of the page, or these threes, right, before they meet with our adult team. So transfer of care, right? So again, this transfer, this is where we're actually going to find you a new medical team. It's probably going to be in a different building. Sometimes it may be in a different facility. What we do is we talk about this, we have them reach out, make the adult appointment, and they confirm that date with us. When I know when that's going to happen or who their provider is going to be, then we create what we call a transfer package. This includes a lot of medical information, sometimes necessary letters. I let the adult providers know that I will continue to remain available to help assist with care any way that I can. For me, this is a checklist of things that I include, right? So it could be my last office note, a list of your medications, maybe it's the report from the transplant surgery, any imaging studies that may have been done. And I also really make a note to document who is your primary care doctor. Because I think one of the big differences between pediatric and adult care is that, oftentimes in pediatrics, we do probably a little bit more than just transplant medicine. And have I been guilty of, refilling an asthma inhaler here and there? Of course. In the adult world, that's probably not something that they're going to do. And so you want to have someone that's really going to be overseeing and coordinating your care in addition to your transplant team. If that person is a pediatrician, then you might want to find yourself, an adult internist. Sometimes there are, med peds providers or family practitioners that are used to seeing both children and adults, and so that change might not be necessary. But I do think it's important, that we not make too many changes at once. And so I usually ask most of my patients to try and identify that person before we find them a new transplant team. This is a little checklist that, is available. And again, it's from the Got Transition website for patients. What are things that you should be thinking about? How do you know when you're ready to transfer to the adult team? I'm not going to read every one of these. I'm going to be respectful of some of our time here. But just, knowing things like your allergies, your family history, where your insurance card is, carrying that with you. Knowing that, legally no one can share information about your healthcare without your permission once you turn the age of 18. Again, I kind of like this little cartoon here because I think it really illustrates that, again, transition is a process, right? And so each of these things that are listed here really provide the stepping stones or the foundation for achieving, the next level of independence, right? Again, early on, we're focusing on just, the name of your health condition, maybe the names of your medicines. Then maybe it's what are some of those medication side effects? What happens if you don't take them? And then we move on to issues like, insurance and self-management, right? Before we really talk about finding new providers. So I think this is just kind of a rough guideline about what are the general ages where we approach several of these topics and what makes sense. The final element of the sixth core element is something called transfer completion. So even though you may have met with the adult team, what we do is we usually reach out a few months after your first visit with your adult team just to see how things went. One, to make sure you actually showed up for the appointment, right? And then how things went. We ask for feedback on things we could have done better, maybe things we didn't prepare you for, right? See if there's any difficulties with communication with the adult team and see if there's ways that we can continue to offer our services. And I will say I have a really close relationship with a lot of my adult colleagues. We work really well together. We talk all the time. So it's not like, once you're, in the new facility, like we just kind of disappear altogether. That's just simply not true. Again, just to kind of show you a little visual representation of the timeline that we were talking about. The only thing that I wanted to highlight is that, again, transition should start somewhere around the age of 12. And then again, as you go through this process, what I really want to also highlight on the other end is that, transition doesn't stop at the age of 18, right? This is something that, for several reasons we touched upon, continues to your mid or even late 20s, right? And it's something that you continue to address with a lot of your adult team members. Transition of care is certainly a multidisciplinary effort, right? So your transition team will include not only like hepatologists, nephrologists, cardiologists, pulmonologists, advanced practitioners, pharmacists, psychologists, social workers, right? They're all really important, making sure that we're giving you all of the resources available. So when does this transition process end, right? Well, this may be a little bit of an exaggeration, but again, the point that I'm just trying to, sort of really highlight is that, again, transition is a process. There's no clear start or stopping point, and it's something that definitely continues even after you transfer to the adult team, right? It requires collaboration amongst your pediatric providers, your adult providers, your family, right? And this is really vital for us to sort of improve a lot of those outcomes that I highlighted at the beginning of the talk and make sure that we're keeping you healthy and functioning and happy. And for those of you that are still wondering, yes, but what is the difference between my adult team or between my pediatric team and the adult team? These are, again, just a few things, that I think I've touched upon, but when you're in pediatrics, a lot of times your team may be talking with or focusing on your parents, right? When you go to the adult side, the expectation is going to be that we are now focusing and talking to you. Your parents can be there with your permission, right? But they are not going to be the ones speaking up. If things have to be explained regarding your medical history or list your medications, those are going to be things we expect of you. Your parents can, again, continue to be involved, but you're going to take primary ownership. They can help you, maybe pick up your medications every now and then, but you're going to be making your own appointments, getting your own medicines. These are the expectations, right? Again, we've talked about privacy. We talked a little bit, about you're going to want to carry around your insurance card. If you finish a visit with one of your providers, right, there may be a copay. You're going to be expected to pay some of those bills, right? You're going to have to know your history, your vaccines. And like I mentioned before, you're going to need to find a primary care doctor because, certainly many adult providers are not willing to manage things that are sort of outside of their specialty. How can you become better prepared, right? So again, just a few tips that I think about is I really encourage all of my patients to, write down any questions or concerns, things that I say that don't make sense, things that they maybe read on a website or hear from some of their friends. Let's talk about it. Keep a list of your medicines, any allergies to any medicines. I don't care if this is an index card that you carry around in your paper. I know that no one's doing that anymore, but there is a way, take a picture, keep it on your cell phone. There are certain apps, one of the ones that I really like is something called My Transplant Hero, where you can keep track of your medications, medication doses. It kind of helps you by setting alarms throughout the day so you know when your medicines are due. It can be important. Another thing that I do with a lot of my patients is I have them take out their cell phone and I have them enter my name and my office number. And I make sure that they understand, that if there's ever an emergency that takes place out of, traditional business hours, 9 to 5, they can always call that number and they will always be able to speak with someone that can help address whatever their concern is. This is not a number that should be used at 3 a.m. to request a medication refill. That is not appropriate. But any type of emergency, off hours, weekends, absolutely. Keep a copy of your insurance card with you. Ask your doctor where you should go if it's after hours and you need help. Don't be afraid to speak up and ask questions if something's said that you don't understand. And then, nowadays, I know that everyone is very tech savvy, very resistant to using, the actual phone app on the phone. And so many times there are ways to communicate through online portals as well. Okay. So in summary for today, again, goals of a healthcare transition are really just to keep you healthy, to sustain your well-being. It's a way to help improve many of the self-management skills that I talked about in order to do this. And really, you've been through so much already with the idea of transplant. You, your families, your whole healthcare team, we really want to just work to keep you physically well, happy, and really doing the things that you enjoy. If we don't do a good job with transition, we know that the outcomes can be bad, right? You don't feel good, you're not thriving. We don't want that. We're going to use a lot of these transition tools that I sort of talked about to help improve this process to get you where you need to be. And I really do believe that healthcare transition programs, right, the multidisciplinary approach, all of the resources available can lead to important long-term gains in the future. This is just a few websites that I think would be helpful, sort of resources for everyone. I can keep these up here. I'm sure we can share them with you. But otherwise, that was most of what I wanted to address today. I'm going to...
Hey, Dr. Vittorio.
Yeah.
Thank you so much. That was fantastic. Thanks so much for, donating your time and your expertise to this important topic.
Absolutely.
I'm going to go. I do invite participants if you'd like to use the Q&A feature. We're at the 6 o'clock hour. However, we got a couple minute late start, so we're going to hang on a little bit and have some discussion. So feel free to stay tuned here. If you want to use the Q&A feature on the right-hand side of your screen, feel free to submit questions for discussion. While we wait for that, again, I thought that was fantastic. You really highlighted best practices and really how important the transition readiness process is. And what we can do as providers to support patients and what patients and families can do to collaborate in their care as well. I thought that was fantastic. And I loved your mantra that transition is a process, not an event. Transition is a process, not an event. And those are words to live by. Good. So waiting for some questions to come in. People did submit some questions in advance some of them are CHOP specific, and obviously they weren't geared toward your lecture. But I can review some of those too, because other people might have the same questions. And anyone that submitted a question in advance for registration, if we don't cover it here, we will follow up with you by email to address those questions as well. So again, thanks everyone for attending. And I think I want to highlight some of I'd love to hear about what your program's been doing, some of the things that you've been developing. CHOP is, we're committed to supporting our patients, giving high quality patient family-centered care. And we've got a lot of exciting stuff regarding transition work coming up too. Developing some transition special interest working groups, posting policies to our websites for transparency with family and multidisciplinary input. Developing teen clinics or adolescent clinics. Kidney team has been doing this for a bit, but we're expanding it to other organ groups as well for multidisciplinary care and transition work, and talking about some of those assessments as well. We've used the track previously, but I'm going to explore the UNC one that you were talking about too. That looks good. I like how it's, yeah, go ahead.
Oh, no, I was going to say, one of the things that I really like, I think it's a great one because there is that like child and parent, sort of partnership there. I think it's also great because it's, like I said, it's provider administered. So for me, it's just sort of helpful to sit down and hear the answers, sort of out loud. And then, whether or not this is right and wrong, it doesn't matter. But I use some of the, if I get an, I don't know, I'm not sure, can you elaborate? This can lead to important discussions, right? So for that reason, I really find it very valuable, and it's something that, that I do track over time. And the other nice thing is that it really breaks down a lot of these different domains, right? So if I see, so you can get a total score and an idea of where you are in terms of overall transition readiness. But the other component that I really like is it can highlight if there are certain areas that are maybe weaker than others, right? And that I can, then focus a lot of my education or some of our goals on improving those areas that, seem to need a little bit more work.
Great. We have some questions coming in now. Can you say the app that you recommended again? Was it My Transplant Hero?
Yeah, so for medication adherence, I've tried a few different ones. One that we're, really liking right now, it was actually designed by a transplant surgeon, a liver transplant surgeon, it's called My Transplant Hero. And basically what it is it's an app where you can, put in all of your different medications, right? So if you put in, let's say, a lot of people may be familiar with tacrolimus. So if you put in tacrolimus, you can then pick the different pill strength or liquid or whatnot. You can set the time of the day that you think you're supposed to be taking it. And you can also, at the same time, set an alarm for that time. And then what it is, it's like a little bit of like a game. So if the alarm goes off, you take your medication, you sort of, acknowledge that. And then there's a way to like kind of, like win stuff and whatnot. So it can be kind of entertaining at the same time. But I think really the important part, or what I see as the most useful part, is the alarm, right? Because, I think we're all guilty of, we sleep in a little late, or we're running around, after school, after work or something like that. And we just kind of lose track of time. So I think it's a helpful reminder.
Yes, I often encourage patients to use alarms on their phone. I think it's a great reminder tool. We call it use little help sometimes. Mm-hmm. There's a question, can you put up the link slide again? I believe that's the one of your slides that was the important links. We can also send that out to you, to the attendees as well, because you can't click on these links that you're going to post up. But yeah, if you want to share your screen again and just share that link slide.
Absolutely, I'm into that now.
And while you're doing that, some of the questions that were submitted in advance, this one was more CHOP specific. So the question is, will most of my history or information get transferred to the adult hospital? And I think that's a great question. Each of our groups, our separate organ groups, kidney, liver, heart, and lung, have their own distinct practices. We all use multidisciplinary approaches. However, I can speak for the kidney team. We make contacts. We collaborate with you to identify a provider. Sometimes that is based on your insurance or your geographic location, but this is, we work with you well before that time. And I invite people to tune into our social work presentation, which is going to be, again, this is the first of our monthly series of 4 sessions. So we'll talk more about that. Yeah, so we do we identify the provider, we send a medical summary, oftentimes as needed, a pharmacy overview and a psychosocial overview as well. We offer to meet with that provider, talk with them on the phone, and depending on the institution, we also sometimes will have biannual meetings to talk about upcoming patients so we can review them together and ask questions. And we, as CHOP, we're always available to that adult team that you transition to if they have questions, want to talk about anything, they want to collaborate on care. I think you highlighted this too. It's important to have a medical home once you move to adult care and not split responsibilities or have differing opinions. So having one person, that quarterback that's managing it, but we're always available to support and give advice, and reach out to us. Let us know how you're doing as well. Drop us a line or an email. We like to hear from transition patients as well. But yes, information gets transferred to the adult hospital. So this is a question from one of our attendees that the program was excellent. Thank you very much. This question isn't exactly about transition, but could the increase in organ failure in the early 20s be because the organ itself is starting to fail and not as much about non-adherence? I have opinions on that, but let's let Dr. Vittorio cover that one.
Yeah, no, so that, I mean, this could be a whole talk in and of itself, right? Because I think that's such an important point, you know, and I go back, you know, and maybe one of the things I should have also highlighted on that slide where I tried to talk about, you know, different barriers to healthcare transition, and I put up a number of different things, but I think that brings up an important point, right? Because you know, let me speak more, you know, what I'm familiar with would be liver transplantation, right? But most of our liver transplants, right, are done probably early on in life. And so when we think about, you know, a successful transplant in the adult world, right, and so someone that, you know, survives with this new organ for 20, 25 plus years, right, everyone considers that, you know, a win, right? When we look at someone who receives an organ transplant, you know, around the age of 1 or 2, well, 20 years old is going to bring us right around this time of like late adolescence, you know, young adulthood, this transition period that we're sort of talking about. And so I do think that's an important point because there are a lot of immunologic factors that certainly play a role here. I know that within, you know, the liver transplant community, there's a lot of debate regarding the role of what we call protocol liver biopsies. So this means even though we may not have, you know, concerns that there's something going on with the liver, for instance, your blood tests look okay, there are certain centers that advocate for performing these sort of routine biopsies to see what's actually going on within the organ. And, you know, I will say that here, you know, we're one of the centers that probably recommend doing that about every 5 years or so. It's not the same honor with our adult team. And we have seen, you know, changes that have caused us to change around some of our, you know, medications. I think it's a very difficult balance sometimes because, like I mentioned, you know, different, many of our different transplant medicines or all medicines, you know, we use them for a reason, but they all have certain side effects, right? And so for that reason, I think we're, you know, we walk this fine line where we're trying to balance, you know, how much is too much and how much isn't enough. So what I mean by that is, you know, if we run immunosuppression a little bit too high, then we may see, you know, complications like diabetes or high blood pressure, things like that sort of develop in the future. If we run, you know, medications or a lot of these transplant medicines too low, then we may run into trouble with like graft rejection and things like that. So where does the balance sort of lie? So certainly there is a role for the immune system, the management of medications, that difficult balance that certainly also impacts, you know, organ health. So that's an excellent point.
Absolutely. Yeah, it's not solely about adherence to medication, but that is an important component. Absolutely. So I wanted to share these slides here. We're getting to 6:10, so we're going to bring it to a close. The session's coming up, Psychology and Social Work in May 6th, Pharmacy and Adolescent Medicine, June 3rd, and those breakout sessions with discussions with adult providers, talking about guideposts to transition your care on July 8th. We're going to send everyone that was an attendee today this REDCap survey link. We invite your feedback to about what you thought about the presentation, any and all feedback, and also some questions about future topics that you'd be interested in. And I'm going to stop sharing my screen here and just say thank you again, Dr. Vittorio. This is a great kickoff to our transition webinar series. And thank you all to the attendees as well.
Yeah, thank you so much, Sean. I really, really enjoyed being here with you all today. So thank you again for this opportunity.
Have a good evening.